My name is Michael McBride. I'm a consultant plastic surgeon working at Cosmetech at Kingsbridge. I'm a consultant plastic surgeon. I specialise in facial aesthetics, and I'm going to speak about facelifts. And this surgery, it really aims to address a number of issues which are a consequence of the changes that we all get as a result of age. We have sun exposure, occupational exposures to our skin. Our skin becomes thinner, it develops lines, it loses the elastin quality and the collagen levels. Within the soft tissue of the face, we tend to lose volume in certain areas. We get volume that falls more centrally. We get heaviness or fullness of the nasolabial folds, the marionette line or the melolabial fold, which extends down to the lower part of the jaw, which is known as a jowl. And we lose volume in the upper third of the face, overlying the cheekbone. And this causes the face to have more of a square appearance, and surgery, in the right indications, can address these issues. Facelift surgery is a tried and tested operation. It's evolved over the years in terms of the technique that's undertaken. And there are a lot of different techniques that are still undertaken by a number of different surgeons. The key thing is for that surgeon to identify the aims and expectations of that individual patient and apply that to their intrinsic anatomy and undertake a technique that they think is safe and appropriate. The technique that I undertake is known as a deep plane SMAS lift. I feel this is beneficial because the facial anatomy has 6 layers. The SMAS is layer 3, and that's the area that tends to become attenuated and weakened, and the volume then, both within the SMAS and above it, can fall. A deep plane lift aims to work underneath the SMAS, which is layer 4, the space, release a number of the key support ligaments of the face and or neck, and then lift that area of volume and suspend it without any tension, without any abnormal vector, and remove any degree of tension on the skin closure, which is important. It's all about avoiding stigma of surgery, having a nice, natural appearance after surgery. It's about turning back the clock, and that's a really tried and tested and consistent result with a deep plane lift. During surgery, it's generally undertaken under either twilight anaesthetic or a general anaesthetic. The surgery can last anywhere between 3 to 5 hours. It all depends on the individual anatomy and what's required. The surgeon makes a number of incisions which can extend to a variable degree within the hairline, around the ear and or behind the ear. Everybody's indications can be variable. The skin is elevated up to a point to an imaginary line running from the outer aspect of your eye all the way down to the angle of your jaw. The SMAS layer is then entered, and we then enter that space, which is layer number 4. The surgeon then identifies a number of key landmarks, releases those ligaments, whilst making sure that the motor nerve is safe. Once the face has been mobilised and freed enough, the surgeon then lifts and elevates and secures this area of skin and volume to an appropriate area which is higher up. It lifts the volume, it removes the square appearance of the face, converting it to an inverted triangle. We get a natural appearance of the midface and over the cheekbone, and then we remove a small amount of skin. There's no tension on the skin is closed, very fine sutures, some of which may need to be removed, and then you're placed into a garment. which really supports the face and neck region. I don't tend to use a drain, and you generally get home either later that same day or the next day. There's a general recovery after any form of anaesthetic that can take anywhere upwards of 4 to 6 weeks. The surgical recovery generally falls into 3 phases. There's an immediate phase within the first 1 to 2 weeks, through which we remove any dressings, remove any sutures, and a lot of the swelling and bruising, if there is any, should be settled. At the end of the 2nd week, you would hope to be able to return to most normal things, socially anyway. From the 2nd week up to week 6, there's an overall recovery. Areas of any residual swelling, any areas of skin healing should be almost fully settled. And you can return then to various forms of exercise and an appropriate time frame for you. The more longer term recovery extends from week 6 to month 3 and then upwards to a year, through which the overall appearance continues to improve, scars settle, and then hopefully we have both a surgeon and a patient who's very happy. The risks and complications of facelift surgery are important to relay to any patient as part of a decision-making process. There are a number of general risks with any operation. These include infection, slow wounds, wounds that may open. There are consequences of surgery that include altered skin feeling and scars. And they are 2 important things that are more of a longer term thing with any surgery, but specifically after a facelift. Other important things that any patient must consider are residual asymmetry, over or under correction, any little irregularities or anomalies with the shape and contour, and early recurrence as well. And the most important risk is injury to the motor nerve, which is known as the facial nerve. The facial nerve runs in a specific layer of the face, and a deep plane lift works within that layer. But to my mind, knowledge of anatomy, visualizing the nerve, the risks are low. And we know across the literature, the risk of a nerve injury is less than 1%. And of all techniques used, it's lowest with this technique, which is a deep plane lift. I have found across this technique, the risks of all of those things is generally very low. A referral is required on behalf of the individual, so they can self-refer. It's important for any individual to appropriately weigh up all the information. So there's a lot of information available nowadays about a facility and or a surgeon. It's important to make sure that they're appropriately trained, certified and qualified, and that they undertake these surgical procedures regularly. They audit their outcomes so that there's safety and there's a reliability that you know who's looking after you is the right person. When you meet the surgeon, they normally identify your aims and expectations. They assess your medical health fitness for treatment and or surgery. And it's about then fully discussing what's involved, the recovery, what's the downtime, as well as the risks. And it's about making a combined decision, but most of all, the right decision for you and having this undertaken at the right time. The average wait time from consultation to surgery, it can be variable. It's always important to have a period of cooling off, both for the patient and the surgeon. A lot of information is obviously relayed at the consultation. Information is then sent to the patient as well. Combining all of this, involving family, friends as part of making your decision is important. Cooling off periods can vary anywhere between 2 to 3 weeks, but this is a minimum. It's about making the right decision. And these operations can be undertaken at any stage. It has to be the right stage because it's something you only want to do once.